Hello, iRadio, iMedia followers. Today we are in a visit to Juba Teaching Hospital, and we're with the Director General of Juba Teaching Hospital, Mr. Dr. Anthony Simon. Dr. Anthony, how are you? Can you introduce yourself to our followers on iMedia and iRadio TV?
Yes, thank you. As you have said, I'm called Dr. Anthony Lupai Simon, the Director General of Juba Teaching Hospital. I've been a director in this hospital for a period of 3 months now. That is from January up to now, started on the 13th of this year. So I'll be happy that I'm talking with iRadio media because it is one of the widespread media in the country where we are able to send our message widely to our citizens in the country. So I'm privileged to be with iRadio today.
Thank you, Doctor. Can you just give us an update about the situation in the general in the hospital here, the general situation, how the things are going with this difficult time of the coronavirus and all those issues?
Yes, I think Juba Hospital is in the country because the country is facing a lot of difficulties. And then I think the hospital is not going to be exempted from that difficulties. These difficulties is enormous. First, we have the resources that are to be made with the hospital. We are not having that full resource. We have some limited resources to be made available. We also have manpower in the hospital that are working, and then you see also human beings need fuel, which means they have to be also given something properly so that they work properly. We had, for the last, about 3 months ago, there had been problem about doctors calling for some incentives and all that, especially when the issue of this corona came in. We were lucky that some or part of that incentive was given to the doctors, and they're now doing their duties normally. As you can see, this is the largest hospital in the country. Basically, it's supposed to be what they call... Yes. Basically, yes. It's supposed to be the main referral hospital in the country where, when there are difficulties that cases could not be treated in the states, they come here to get sanctuary and get the final treatment. Unfortunately, to some extent, we are still getting some challenges that we don't fulfill what that is required 100% for the challenge that we have just mentioned. But thanks God that things are going the right direction. And from time to time, we see that our ministry works with the partner to avail some of the things that the hospital needs, but yet still a lot of work needs to be done so that we serve our people in the country fully to suit the name of Juba Teaching Hospital.
Doctor, before the hospital was having challenges with the water and with the power, with electricity. How did you, as the director, manage to come over all these challenges? Or
this has been a problem and is still a problem in the hospital. Just some 2 weeks ago, we were supposed to pay the bill of the electricity, which we have been paying pre-paying than we used. Unfortunately,
how much?
We have been paying. You see, we have these buildings are divided into different groups. So when we combine them together, we find that we pay up to 10 million SSP
per month.
Up to 10 million SSP, we are going to pay the electricity for all. But we cannot do this because our resources is stranded. We cannot fill that all. So we find that some parts of the hospital are not having the electricity, and then some parts are having the electricity paid. So because the areas that were not paid, we were threatened some time back that the power of the hospital was going to be put off. So we made local agreement with the people of the utilities, public utilities, and we are lucky that we are going, maybe up to the end of this month, there's going to be a problem of the electricity. I'm not happy because we expect that electricity and water supply to the hospital is not supposed to be treated as what is given in the market prices. Some years back, when we had been working in so many hospitals in Sudan by then before the independence, electricity that are supplied to the hospitals, to the police and other government agents are free, and it is through the hotline. And if at all there is going to be something that people pay, it has to be at a subsidized price, because the hospital cannot make that amount to pay all that. So we are unlucky that the electricity and water that come to the hospital are at the market price, which is standing the hospital. Sometimes you find that when we cannot pay the money that is needed, then there's going to be shortage. So the hospital itself cannot stand a shortage of, say, 10 minutes, especially when we are dealing with the area of the theater and when the electricity goes up and people are in the theater, then it's going to be at the cost of the patient. So I'm just seeing that if there is going to be any area or any high authority that could reduce the electricity charges to the hospital or put it through the hotline and free, plus the water, I think that's going to be, because it's really challenging. If there's no water, and then hygiene is also going to be a problem. The first thing that you need to put your area in order is to have water so that their hygiene is met.
Doctor, some of the patients are complaining of the lack of doctor during the weekends. Say they came to the hospital, they found there's no doctors to treat them.
Well, the issue of no doctor is depending on time at which a particular patient comes sometimes. Otherwise, all the departments in the hospital are running 24 hours. Obstetrics and gynecology on the other side, running 24 hours with the doctor available. Here, the main emergencies also having doctors. There are times when a patient may come with, at a lapse of, let me say, 5 to 10 minutes, when that person is not attended within that time of 5 to 10 minutes, then it will become an issue in the whole country that there are no doctors. This is one. Two, some people may come to the hospital because they need a specific doctor, senior doctor, at a certain time. And the senior doctors are not available, not only here in Juba, all over the world. You cannot get the senior doctors all the time available if you are going there because of a particular doctor. So you have to be attended to by these junior doctors. Then if you are stabilized, then you are seen by the senior doctor. This is not tolerated by some of the patients, especially when they come here and they want to see Dr. Anthony. And Dr. Anthony is not here, they extend that, no, I don't like to be seen by these small training doctors. And this is where they go with the message that I was in the hospital, I did not get the doctor to attend to me.
How many departments do you have here, Dr. Anthony, in this big building?
This building, this is the emergency department and accident.
Then
here basically we have medicine and surgery. In this department, they attend to medical emergencies and also attending to surgical emergencies. Then on the other side is the obstetrics and gynecological department also. We have also emergencies and an outpatient in the obstetric and gynecology department. And then we have some small departments within for ophthalmology, for people of ENT. All these are available in the hospital, covering everything.
Can we have a small or take a look to the gynecology department?
We may go there, but let us say general look about what do we expect for our patient when they come to the hospital. We say when they come to the hospital, most of the time they say your hospital is littered, it's dirty and all that.
The issue of the hygiene.
The hygiene and all that. And they think it is the doctors who have made it dirty or the doctors that have not cleaned the hospital. So I'm just appealing that cleanliness of the hospital begins from the people themselves. When they come here, they have to take control of the waste they dispose in the hospital. You cannot throw anything anywhere at any time and then come after 3 hours to say why this thing is not there. So we are asking our citizens that let them help us in the maintenance of the hospital by putting the dirt in the right place so that it is easily collected. You cannot just throw everything anywhere. Secondly, we have problem about the usage of some of our toilets here. We need to see that when they come, they should use this toilet as the toilet they have at home, because That's where we are going to have the hygiene. Today, if it's badly used, it close, and then they come to complain that no toilets, because if it's dirty, not properly maintained, because it is intentionally dirty, then it's not a problem in the hospital. It is our problem. So we have to use everything as our property so that we keep it clean together with the citizen. And then also we expect when patients come to the hospital, they are accompanied by their relatives. They also should have to be friendly to the doctors that are in the hospital, because some of the challenges that we have not mentioned in our talks is our interactions with our people.
With the patients.
The patients, especially when they bring a very ill patient, they are emotional, and their emotions are always stand on the doctors, who are here to save lives, not to destroy lives.
Tell us now which department is this one?
We are now standing in the Department of Obstetrics and Gynecology. This is where all maternity or maternal conditions are dealt with. Pregnant women who are just coming here for normal antenatal care, they can be seen on the other side. And we have those who come for vaccinations, those who come with some sickness and they are attended to, those who come with the labor pain, they are all seen in these offices, and then they are distributed to where they are supposed to be seen. Basically, this, as I said earlier, a part of the main hospital in the country, more or less the largest obstetrics department in the country. We are having a number of deliveries that are being conducted every day, a total of at least 25 deliveries per night. And then these are normal deliveries that we conduct. We have also some operations that are done. These are different types of operations being done. Some of them are gynecological operations, and then some of them are obstetrical operations like cesarean section being done. We may have 3, 4, sometimes 5 or 6 cesarean section being done per day. We are here because we need to know what is going on in this department, because when you go everywhere in the world, the Department of Obstetrics and Gynecology is one of the most sensitive. Sensitive in the sense that when there is any problem that has happened to any mother, it sends an alarm. Because you may have in the surgical ward, you may have in the medical ward, patients may lose their lives. It does not cause alarm. But if one woman loses her life in the Department of Obstetrics, you find that the whole country is set an alarm as why should that woman die. And this sensitivity is not only limited to the hospital, it is extended whereby we find that the obstetrical department is where the doctors also face some of the challenges in relation to their reactions with relatives of the patients.
Doctor, let me ask these questions. For the last years, we've been noticed that the number of the C-section comparing with the normal delivery, it's become higher than the normal deliveries. What was the reason for that? And which one is safety for the mothers, the C-section operation or the normal delivery?
Of course, we have to see that everywhere in the world, the number of cesarean sections increase, not only here in Juba Teaching Hospital, it is worldwide. It increased because, first, the population is also increasing for people that may have problems. 2, it increases because some of the patients that were delivered previously by operation are having high chance of being reoperated. That's why you find that if you had operated, say, 100 patients 2 years ago, at least 30 of them are going to be operated again after 2 years. That's why you find that with subsequent years, the number of operations are increasing in the hospital. Secondly, operations are also linked to the hospital. If the hospital is a referral hospital like Juba Hospital, we expect the number of cesarean sections to be more. Why? Because all these cases that were having difficulties in the small delivery centers that could not be operated there are sent here and they are going to be operated. That's why you find that where we have some secondary or primary health care where they just conduct normal delivery with no complication, you can have nil cesarean section. But all cases that are supposed to be operated in their center, they sent. Sent where? To Juba Hospital. That's why you find that we statistically in Juba are having the highest rate of cesarean section because we attend to the most difficult cases that are not be attended to in the small centers.
Okay, doctor, can you tell us how the management of the hospital deal with the patient that been affected with the transmitted sexual diseases, concerning the issue of consultation and trauma healing and all those things?
Well, I think as you have been asking me from the beginning, we have given them there are different sections that are available here. Here, basically, we deal with the general condition, but then we have areas where we deal with some of the sexually transmitted diseases. Most of the sexually transmitted diseases do not have stigma, but we are afraid of one major sexually transmitted disease, which is the HIV/AIDS, which is a problem to us. These are dealt with because we need to see that every patient, women that are pregnant, they are safe, and they also carry safe babies in their womb. And then we have what they call PMCT, that is prevention of maternal to fetal transmission of this HIV. There's a section that makes counseling to people before they are checked. If somebody is checked and found to be positive, medications are given to them accordingly. I think these things are being handled. We don't do it alone. We have partners that we have these NGOs, partners like ICAP and some of the WHO. They have also some input helping the hospital to run some of these activities to carry out this management operation.
Also, I saw when we were passing by, there's a department or there's a one-stop center for dealing with the GVB cases like the raping and all those. What can you tell us about this?
Yes, we say gender-based violence center that is to care for those young girls, not only young girls, we have some also women who were molested, who were raped and all that. They come here not only just to be given medicine, because some of them may have some injuries during the course of this assault. Then they are treated, they are given medication, and they are also counseled how to live with that trauma of being raped. That is part of the center of the Department of Gynecology that is available. Now, in all this that are happening in the hospital, in the department, in this that we have worked out, there's one important thing that you're very much concerned about, that's which I want IRAD also to take as a message to our citizens, is the relationship between the doctors and the people that bring their relatives to be treated in the hospital. Just a day ago, one of our doctors in this department was assaulted and then beaten by a relative who brought her wife to be treated, and then there had been a complication that arose, and the relative thought that complication was done by the doctors in the hospital. So I think I am here to send the message of education to our population that the doctors in the hospital, they are here to care for every patient that comes. They spend 24 hours. Sometimes they don't eat. Sometimes they eat little. Sometimes they don't have anything to come with to the hospital. They come here so that they save life of the patient. And that's the primary reason why they're in the hospital. Complications cannot be avoided everywhere or all the time. Even in the high centers like the United States of America, patients may have abortions happening. Miscarriage are happening. If it has already started, no doctor can stop it, such that when you see a doctor giving some medication trying to relieve pain and then abortion or the fetus expelled, some people may think that the doctor gave the drug and that has caused the baby to come out. That was exactly what happened that resulted to that. And I would say this is because of ignorance. So I think we need to have our people ask the doctors what is the problem, to be given why that thing happened before they get into assaults, because abortion is happening everywhere in the world, and the doctors, they try to treat patients that present to the hospital. Because what brought the patient to the hospital is a problem. And if something happened, it's not because the doctor has done something bad. It is because that problem has increased beyond the capacity that it could be controlled, and then patient may have that abortion. Some may even lose their life. Like we have patients brought because they are having convulsions, eclampsia. We try to give medications. Unfortunately, they may lose their life. So I think this one should not be counted that it was the doctor's medicine or it was the inaction of the doctor that has resulted to the death. Let us help our doctors to treat us. This is my request, my plea to the population as a Director General of Juba Teaching Hospital. The doctors are in the hospital to help the citizen. The doctors in the hospital to treat, and the doctor this also needs to be cared for them to care for the patients. So I think if we are coming to the hospital, we should know that we are here to be saved. We're in a safe hands. The hospital, not in harmful hands, as some people may think that no, these doctors are given. Yes, we have some young doctors, but they don't work alone.
This is the end of our interview with Dr. Anthony, the Director General of Juba Teaching Hospital. I was with you, Michael Daniel. And behind the camera, let's not forget our colleague, Lo Nelson, for the good video we have. Thank you, our followers.